who are delivering in our health facilities, but we encourage our the community to come and use our facilities. You have seen what CIDI has given us. They have given us so many items for health workers to use. So we encourage the community to come and utilize our facilities. But the most important, the most common challenge we have is about male involvement. We encourage our colleagues, the male, to really see that the ladies or the wives use our facilities so that they don't deliver from the village, whereby they get so many complications of delivering, at times even.
As CIDI, we have tried to provide various items for essential deliveries at the different health centers. For instance, today we are at Namuonge Health Centre 3. According to the waste management assessments that we had previously, we noticed that people are in need, or the health centers are in need of the waste disposal bins for the different kinds, and we've tried to provide them. We also realized that patients and health workers are at a very high risk of getting infections while handling wastes. So in the bid to cut that down, we have provided some waste disposal bins. We've also provided gloves to help cut down these infections. And also we are also trying to be in line with what the WHO states, that now most of the funding is going on the 5% of the funding for health programs is geared to waste management, due to cut down these issues of infections during handling waste. And you try to make also
In Nabutiti Health Centre 3, we don't have power and we are lacking even transport. So our pregnant mothers, they almost come. In a month we can get like 25 only. And we have also delivery kits. We have also even mama kits. After delivery we have to give them.
So every mother gets a kit?
Yeah, they're supposed to get.
What is entailed in that kit? What is in that
We
kit?
have the cavera, the
This
glass.
is the kit?
Here we have the cavera, we have the child's skirt, we have even the pamba, even the cotton, even the cord leakages, we have even a gireta inside.
I can see there it's from government of Uganda. Government supplies.
They are the one who gave us.
Do you get stocks all the time? Enough stocks?
Yeah, we have.
Okay.
For our mothers, after deliveries, we brought them here because they're supposed to rest here for 24 hours. Then after, we discharge them.
Sister, you bring out the issues. What problems do you have?
The problem we have here, we are lacking more beds for our patients because sometimes we can get many, like 4, 5, but here we have only 2 beds.
So what
It is
happens
not
when you
enough.
get more patients?
They
Do
can
sleep
sleep down.
So you ask them to bring
We
mattresses?
want them to bring for us more mattresses, even a stand.
Now it has more space.
It has more.
Young one. Young.
Mama Ken.
Okay.
Mama Ken.
Can you see?
Bye.
Bye. Now we're going to calorie. Kona kazanyo se.
Soko je. Yangu yako.
Given to boost Nabutiti Health Centre 3 to improve on the hygiene and also to boost on the people they deliver services to.
Yes, I'm Helen Kasuja, and I'm representing the Executive Director of CIDI. CIDI in full is Community Integrated Development Initiatives, and we are here to complement government efforts as regards maternal child health. As we've noticed in our journey, you realize that most of these health centers have a lot of challenges, and that's why CIDI came up to complement government efforts, especially as regards solid waste management. There's been a challenge because there are so many deaths that occur that could have been avoided because of poor management of waste. Waste, we are talking about needles, we are talking about placentas, we are talking about gauze wire, cotton wool, all those disposables. If they are not well handled, they can be highly infectious and they can lead to death of both patients with other infections and even the health workers. And in Uganda right now we have a scare of Ebola, so this brings to highlight the challenge health workers face. That is why CIDI has delivered these items today to complement the health, but specifically maternal child health. And we've delivered disinfectants, we've delivered dustbins, but these dustbins are highly classified, so we have dustbins.
Start again.
Yes, I'm Helen Kasuja, and I work with Community Integrated Development Initiatives, and my duty today was to represent the Executive Director, Dr. Juko, as regards the maternal child health project that CIDI is implementing in these areas of Wakiso, Mukono, and Kampala. Right now we are in Mukono, and we have experienced health centers. What we find in these health centers at times it's very deplorable. When we were in Nabutiti, we saw an admission ward that had only 2 beds, one that is not even specified. So CIDI comes in to complement government efforts, and we particularly noted about solid waste management. And that's why we have delivered things like jik, dustbins, and the essence is to reduce on the infection of patients, on infections of things that they did not come with because of poor handling of disposable waste like injections, gauze, and cotton wool, among others. The dustbins we brought are highly specialized, so they can be classified. The highly infectious are put alone, and they have a red marker. The yellow ones are just infectious, and the black that are for non-infectious. So this has excited many of the health workers because they realize that this is a gap that has been there, and CIDI has been one of the very few partners that have thought this is necessary. Because many people in most cases think of consumables, and when they think of health consumables, they never think about the waste management. Yet it poses a lot of risk, especially now that we have highly infectious diseases like Ebola. So among the consortium of things that we brought JIC, which is used in maternity wards and all these other areas for cleanup to reduce levels of infection. However, when we've gone around these health centers, we've also realized that they do not have enough water capacity. They do not have toilets. For instance, where we are standing now at Kasozi, they have a 2-stance toilet that does not even seem to be functional. They have a water tank that you see there that is not functional, though they have one at the maternity ward. Even then, I've been made to understand that it's also leaking. So this requires us to put in concerted efforts to ensure that when facilities are in place, they are facilities that can be used. They are not facilities that are sick or something like that. And we must commend the government of Uganda. For instance, here they've put up these health centers. I know they're doing an effort. They've put up the maternity wing because this is a health Centre3. I know the resources are limited, but we pray that health is prioritized more. We are not saying government is not doing anything about it, but we are saying a lot more can be improved in the facilities that we have so that our people can have a healthy life in line with the national health policy, which promotes socio-economic development through good health. Thank you.
Donations, but now
Centre3, and this is where we admit our patients, those who come from OPD. And there we have family planning station. And this is the cover for maternity where we keep our drugs.
I can see outside it's a maternity ward and a community government.
Yeah,
where is the delivery bed?
This is where we are doing our antenatal, and that's where we do the what in EID and infant diagnosis. This is our other suite.
this is what?
This is our delivery bed. We have only one.
You have only one. How many mothers do you normally get in a month?
In a month, 24 to 25.
25.
It's like but sometimes they come like two, and we fail to get where we deliver the second one from. So we end up taking them to postnatal ward, and we deliver them from there.
How many health workers are you here?
We are 2 midwives. Health workers in general, we are 12.
How many midwives?
Midwives are 2, nursing assistant 3, clinical officer 1, nursing officer 1, that is nursing side, then comprehensive nursing 3.
Okay. The beds are empty. Where are the mothers?
The ones who were there were discharged this morning. We had 2. And other patients, the admissions we had, we referred them to Mulago. One was anemic and one
was what?
Anemic.
Okay.
Then another one had a problem. We couldn't hear the fetal heart, and she had eclampsia. So we had to refer her to Mulago.
Do you follow up those mothers?
Yes.
Have you heard from them?
Yes.
Are they okay?
Yeah. They're improving.
Were they due? Were they due?
No. She was 27.
Do you have challenges now if you're referring patients to Mulago, for instance?
Yeah.
How do they travel? Do you have an ambulance?
We don't have, that's the biggest problem we are having. And another thing, we don't have power. At times we deliver using our torches.
You
from
deliver
the phone.
using torches?
Because at times we have one lantern and we find would like to deliver like 2 mothers, so we leave one lantern there, then you use your phone to deliver the second mother.
I saw down there at the OPD. How many people do you normally get
From
from
OPD,
the outpatients department? How many people do you
those
normally
ones like a day, like between 30 to 50.
30 to 50. But I also
If it is not a Thursday day, when it is a Thursday day, we get like 80.
you get like 80. Yes, then that brings me to an interesting thing. I saw you have a pit latrine that has 2 stances. How do you ensure privacy? Are those stances divided into men and women? How do you handle? How
They
is that?
all use one. But from a different side, for us, we have ours here.
How do they keep the hygiene down there?
We clean.
And I saw the water tank is also not functioning.
It's not functioning. But
So they come up and use the one from
we get water from this big tank. When it's not there, we go to the borehole. It's very near down there.
For how long has this maternity ward been here? When was it constructed? Are we having an idea? It looks pretty new.
Yeah. For me, I don't know the years it has spent, but for me, I've just spent here 1.5 years.
And how are you happy here? Do you enjoy being
I would be happy that the problem, yeah, partly I do. But at times especially delivering a mother using your torch from the phone, that one stresses me up. I don't feel good.
Probably that's when you start barking, that attitude that
we don't bark at
patients normally say.
They say that we don't do so because I have ever delivered and I know what they go through.
So the biggest challenge is lack of, but I saw you have a solar panel.
We have it, but by 8 it is off. 8.
Why? Is
we
it
complained and
is it weak or?
Yeah, it's weak. I think they have no, maybe it is with their converter. I don't know where the problem is. But we reported several times and they did not help us. We decided to keep quiet.
And when you're treating these mothers who come for ANC, yes, do you use an integrated approach? You have everything in one place, like counseling, HIV testing and counseling services?
Yeah, we do everything. From registration, we counsel them, we take them for HCT. From there, in case they are positive, we register them in AID clinic. We do everything. How is the prevalence ideally at the national level? Central region, they are saying we are in the ranges of 8.4. I'm not so sure, but here we get like 4 to 5 mothers, positive mothers. 4 to 5. 4 to 5. And what happens if you find them positive? We follow the procedure. We have to give them prophylaxis. We call them, we give them appointments to come for EID to remove the blood from those young children. We take it to where we're supposed to take it. We bring results to them. Then, in case they need to be referred, we refer them to Art Clinic. Refer to OPD. OPD, that's where they are given the treatment from. Okay. Yes.